Welcome to our webinar on POLST Conversations for Emergency Department Physicians with a Surrogate Decision Maker. I am Dr. Katie Stowers, the Ronald W. Naito Director of Serious Illness Education at the Oregon Health and Science University. POLST enables people with serious illness and frailty to document their wishes for emergency medical care as actionable medical orders. In a prior webinar, we modeled a quick and easy framework to confirm a patient's POLST orders and develop a care plan that is consistent with those wishes. Oftentimes in an emergency, patients are not able to speak for themselves. In this situation, we communicate with a surrogate decision maker. In this webinar, we will model the essential components to navigate this conversation with a surrogate. When providing emergency care to an incapacitated patient with a POLST form, first assess the surrogate's knowledge of the patient's wishes. Next, review the previously documented preferences with the surrogate. Next, validate the challenges of honoring the patient's wishes and what this decision means in the current medical situation. Finally, offer a recommendation for future treatments based on the patient's documented preferences. We will now model an example conversation. I'm Sick is a 90-year-old female nursing home resident with COPD on 2 liters of home oxygen who was brought to the emergency department by EMS with a fever, cough, and shortness of breath. She is hypoxic with intercostal muscle retractions. She does not have capacity for decision making. Her daughter is her surrogate decision maker. Ms. Sick has a POLST stating DNR with limited treatment. Dr. Brown is an emergency department physician caring for Ms. Sick. Listen as Dr. Brown reviews Ms. Sick's prior POLST orders with her daughter and provides a recommendation for treatment that aligns with Ms. Sick's prior wishes as documented on her POLST form.
Your mother is having a very hard time breathing, and she is not thinking clearly enough to talk with me right now. As her surrogate decision maker, I need to talk with you about what this means.
Okay.
Have you ever had a chance to talk with your mother about the type of care she would want if she were to become very sick?
No, I'm sorry. We never talked about that.
She did talk with her doctor about this during her last hospitalization. Based on that conversation, the doctor documented your mother's wishes in a form called a POLST. Can I tell you what your mother said?
Yes, please tell me.
Your mother said that if she were to become very sick, she would want treatments that are easy to tolerate with the hopes of getting back to normal. She would want to avoid treatments like breathing machines. If her heart were to stop beating, she would want to allow death to happen naturally.
Wow, I can't believe she was feeling this way and didn't tell me.
It must be really hard to think about your mother getting so sick.
Oh yes, it really is scary.
I'm worried that your mother's breathing may get worse very soon. I worry that we are now in a place where we need to honor your mother's wishes.
Oh my, I didn't realize how serious this was. What does this all mean?
Is it okay if I make a recommendation?
Yes, please.
I'm worried that your mother's breathing may get worse very soon. Understanding what is important to your mother, I would recommend that we do everything we can to help your mother's breathing feel better. This can include medications, oxygen, and breathing treatments. If her breathing gets worse, this will mean that she is dying. We will not use life support, and we will help your mother die peacefully. What thoughts do you have about that?
I guess you're right. My mom hated being intubated the last time. It was so hard on her. I can understand why she wouldn't want to do that again. This is so hard, but I want to do what's best for my mom. Surrogate decision makers are faced with a difficult task. When emotions are high and stakes are large, it is easy for the surrogate to become distracted by what the surrogate wants for their loved one. It is important to help the surrogate remember what the patient wanted for themselves. It may be helpful to engage members of the emergency department interprofessional team or consultation with the palliative care team to support the surrogate decision maker. We hope that watching this compassionate communication with Miss Sick is helpful in enhancing your skills in talking with surrogate decision makers about their loved one's POLST orders. Dr. Brown has communication skills training in the VitalTalk method. Additional information about the Oregon POLST program is available at oregonpolst.org. Thank you.